Hello and welcome back to the Gut 360 podcast for your weekly dose of Monday morning inspiration and education. If, like me, you're someone who cares about your gut health, whether you're downing kefir and kombucha, striving to eat 30 plants a week, or popping probiotics to support the trillions of bacteria in your gut microbiome, then it's time to turn your attention to the microbiome in your mouth or your oral microbiome, which we're diving into in today's episode. And I'm excited about this week's guest, who I'll be introducing in a sec, so pop your earphones on and head out for your morning walk. Just to let you guys know, this is going to be the penultimate episode of season 2 before I take a little break from the podcast to focus on the relaunch of my 12-week group program, the Mind Body Gut Method. This is the program where you learn the start to finish roadmap to reduce your bloating, manage your IBS symptoms, and resolve your ongoing digestive issues one step at a time. My unique method combines evidence-based nutrition advice with lifestyle strategies, mindset practices, and the ongoing accountability that you'll need to thrive on your health journey. So this program is for you if you're struggling with daily gut health issues, but you don't know where to start. You're tired of cutting out foods without knowing if it's helping. You're suffering with bloating that you can't seem to get rid of. You're looking for a solution to your energy slumps and fatigue. And you might be battling secondary effects of poor gut health, things like acne and hormone issues. So if you're ready to overcome those digestive symptoms that you've been plagued with for years, say goodbye to bloating, constipation, and uncomfortable bathroom trips for good, empower yourself with scientific, tried and tested advice, and feel the best you ever have in your mind, body, and gut, then you can sign up for the Mind Body Gut Method via the link in the show notes below this episode. We start on the 15th of January, and as a valued listener of the Gut 360 podcast, you can get a special discount on the Mind Body Gut Method by using the code MBG40 for £40 off the pay in full option. If you have any questions at all, just drop me a DM on Instagram at Eli Brecher Nutrition, and I will see you inside the Mind Body Gut Method group program. Now let's get back to today's episode. And before we get started, you guys know we have an opening tradition on the podcast, which is the food of the week. So my food of the week this week is carrots, which are a great source of fiber to support your digestion, vitamin A to support your vision, vitamin C for your immune system, and potassium to help regulate your blood pressure. I know this might sound a little odd, but I love adding grated carrots into my porridge, along with some warming spices like cinnamon, nutmeg, and vanilla for a carrot cake porridge. It's an easy way to sneak in an extra portion of veggies at breakfast time. The full recipe, which is up on my website, brecher.co.uk, is linked in the show notes below, so go give it a go and let me know what you think. Now let's get into today's episode on the oral microbiome with Dr. Daniel Sutcliffe, who's a holistic dentist based on Harley Street in London. His special interests are the mouth-body connection and amalgam removal, and he's a proud member of the International Academy of Oral Medicine and Toxicology, qualified in SMART Amalgam Removal, and is one of just 3 dentists in the UK who have accredited status. Welcome, Daniel, to the Gut 360 podcast.
Thanks for having me on. Delighted.
It's a pleasure to have you. I'm looking forward to this conversation with you. So what is the oral microbiome? And can you tell us, is it a good thing? Is it a bad thing? Because typically bacteria in the mouth are known for causing tooth decay and gum disease. So is it always negative?
No, and I think that's the big point. The oral microbiome, it's a community of microorganisms that live inside the oral cavity. And it's a very, very complex relationship. But you are right. We've very much approached dentistry from this. We need to disinfect. So we need to disinfect the mouth. We have mouth rinses. It's 99% it kills 99% of the bacteria. That's the worst thing we can do. There's a lot of good bacteria as well. So it's this second largest microbiome. The gut's the largest, and then the oral cavity is the next. The gut gets a lot of attention. That's great, because I'm an absolute firm believer the bacteria in us can cause us more problems than your normal healthy cells. So we're a superorganism. We live together. So basically, we've got our bacterial community have co-evolved, they've coexisted with us over millions of years. So we are together. What happens if you've got just as many bacterial cells in your body as you have the normal healthy cells? So we've got to be looking at that as well. In the mouth, it's a very complex arrangement because the bacterial communities, they live on the hard surfaces, they live on the tongue, they live in your gum tissues, and there's so many different types of tissues, and each single type of tissue has a different kind of bacterial arrangement and composition around it. So it's a very complex interstructure of bacteria, and it's exposed. It's the start of the gut. So we talk about the gut all the time, which is magnificent, but the oral microbiome has a massive effect on the gut as well, and it is the start. And I think by and large, dentists, we've not really given it as much credit as we need to. It's been very much, we do our treatment, we treat our patients, but I think we need to be careful of everything we're using in the mouth, whether it be toothpaste, whether it be mouth rinses. We have to be very careful of everything. We have to take note of what it is and how it functions. Yes, on one hand, it can cause decay, gingivitis, problems with fungi. You've got periodontitis, which is your next level on from gingivitis. We can definitely get all those problems as well, but you have commensal bacteria as well. So the commensal bacteria are these bacteria that help protect us. They help the body function, and they also help they're also very good at stopping the disease-causing bacteria functioning as well. They can take up space, they can release molecules. So by killing the good guys, we're actually going to get more troubles than if we didn't kill any of the bacteria. So we've got to be very careful. It's very difficult because there's some bacteria we've got to look at, and that's what you were saying: the decay, the periodontitis, the gingivitis. But there's also bacteria we don't want to kill because they're helping function, especially if you've ever read about nitric oxide as well, because that's produced on the tongue.
It's so interesting. I think so many people are scared of this word bacteria. I mean, I hear it all the time in clinic when I am talking to my clients about their gut health and their gut microbiome. And they say, oh, I don't want bacteria. That doesn't sound like a good thing. And I'm trying to explain it's actually really important for our overall health. So
Yeah.
how does that oral microbiome affect our mouth? And does it affect our body beyond the mouth? And what systems does it affect?
Absolutely. So we've looked at, I think, like say, the dentistry we've had in the past is very much like we need to disinfect because it does cause decay, but also the bacteria in the mouth help remineralization. So from a nutrition point of view, when we're putting our nutrients into when we're eating a good diet, whether it be a good diet or a bad diet, that's getting absorbed into the saliva. The saliva then delivers it to the tooth, but it's actually the oral microbiome, the commensal bacteria of the oral microbiome, will actually facilitate the absorption into the tooth of all the good stuff that we're eating. On the con side of that, we do have bacteria. There's one which gets a lot of press called P. gingivalis, and that causes us gum problems. So, and there's also another one called Strep mutans, which causes decay. So if there's always remineralization and demineralization in the mouth. So the remineralization is a state of where we're always putting minerals back into the tooth. Demineralization is where we're losing the minerals. A lot of how that happens is depending on what we do. So eating the wrong diet, we've got in the sugar, we've got the refined carbs, we've got in the acid, the minerals are coming out of the teeth. If we've got the right diet, we're absent of those, the sugars and the acids, then the minerals are going back into the tooth. And it's the bacteria, the oral microbiome, that actually help facilitate that. So as we go nearer towards the demineralization stage, there's a bacteria called Strep mutans that helps then cause decay. So then we get decay, we can need filling, we can lose teeth. And then on the other sort of major dental disease, the gingivitis and the periodontitis, if you're getting the bacterial inflammation, which is where bacteria gets its bad name, you're losing bone levels, the pockets of your teeth and the levels of these bone levels going down, you can lose your teeth. You can lose your teeth from bacteria, from decay, or from periodontal disease. And these are both really, really common things. I mean, it always makes me think that people go, oh, damn, I must have been bleeding a little bit, but, I'll get to that. If anywhere else bled in your body, you go straight to the doctor as soon as you could. It's almost like it's in the mouth, it's fine. But if you've got inflammation and bleeding, that's not fine. It's a sign of an infection. It's a sign of something's wrong with your immune system. The first innate response, that non-specific response, is blood flow, and that's why it's bleeding. So it's a very, very common disease. And I think that's one thing with my profession, how I look with my patients. It's so common. I think it's like 50% of people over 50 have got some sort of periodontal disease. It's so common. And yes, it massively impacts the rest of the body as well.
It's so common, isn't it? And I think it's really important to listen to our body, look for the signs.
Yes.
If you see
Yeah.
bleeding gums, as you would with any other system, any other part of the body,
Yeah.
I always say the same when it comes to gut health. If you're feeling constantly bloated all day long or pain or other symptoms, don't ignore it. You don't have to live with these symptoms or with bleeding gums equally. Go and, speak to the right person and sort it out. And then
You're right, people just keep going, don't they? They go, oh, I was busy. And like you say, I'm feeling bloated, I've got bleeding gums, I'm busy.
exactly. It's so true. And then what about the rest of the body? Because I know the oral microbiome has been in the news quite a bit recently with
Mhm,
links to Alzheimer's, even to
mhm.
certain types of cancers. What
Yeah.
else is it linked to?
Yeah, so back sort of 20 years ago when we were at dental school, we knew the people with periodontal disease. So the gingivitis is just inflammation of the gingiva. So that's where anything with itis is your inflammation. Once it goes to periodontitis, it's the periodontium, which is the structures what hold the teeth. So as the periodontal disease gets worse and gets more severe, we lose bone and then we generate pockets. And inside these pockets, we have some particularly vicious bacteria. Now these are the bacteria we're worrying about. Taking me about 20 years, we knew full well that heart disease, it's periodontal disease, there was some sort of link, and we thought, oh, it's shared risk factors. That's all it is. We've got risk factors of smoking and all the other types of risk factors. It's just a shared risk factor. But over time, we've started to realize it's not just shared risk factors. The oral bacteria doesn't stay in the mouth. There's loads of routes, and we might talk about it a bit later to do with gut health as well. It can be swallowed, it can go straight into the bloodstream, especially so the gum's like a girdle, it's like a protection around the tooth. As the periodontal disease progresses and we lose this bone level, with that protection's gone, these bacteria can then travel, and some of the bacteria in the mouth is particularly vicious. So yes, we do have high chances of having heart disease if we've got periodontal disease. It's exactly the same with diabetes. It's a two-way street. If you're struggling to control blood sugars, you're going to struggle more with periodontal disease. And if you've got periodontal disease, you're going to control it's going to make it even more difficult to control. It's this two-way street backwards and forwards. So if I ever see a patient and we know there's periodontal disease and they've got diabetes, it's that chat. You do realize they're making each other worse. Your blood sugars are going to be harder with your periodontal disease, and with periodontal disease, your blood sugars are going to be even more difficult to regulate. So it's making sure we can educate those patients. It's the same as rheumatoid arthritis. With rheumatoid arthritis, pain felt, severity, onset is all made worse by periodontal disease. So it's very important for us to be able to look at a patient and see all that in the medical history. I know you've got rheumatoid arthritis, and I know I'm your dentist, and I know it's not necessarily, you wouldn't think it's to do with your joints, but it is. The bacteria in the mouth can cause problems directly or indirectly with your joints, and it can make things worse, pain felt worse. The same with Alzheimer's as well. This list keeps going on. We're worried about this P. gingivitis is one of the really, really sort of vicious types of bacteria, and it releases chemicals which can cross the blood barrier. We're now at the point where we know we're looking at correlation and causation. So correlation, we're knowing that people with periodontal disease have higher chances of having problems with Alzheimer's. We just need even more evidence to make sure we've got definite causation. So I'm reading a lot in newspapers about there's a definite link, and we're certainly getting closer to that definite link, but we do need more research. But yeah, there's definite evidence and scientific evidence pointing towards a very great link between the two. It's like you say, the same with cancers, especially colorectal cancers. There's a bacteria in the mouth which is particularly involved there, and we're seeing that a lot with patients who have these cancers. Low birth weights, we're seeing all sorts of links, and this list just keeps getting greater and greater and greater. So it makes what we do even more important.
I think it's fascinating. And it's also crazy that so many people don't realize that the body is one organism, it's one system, everything is related.
Yeah.
People will come in and they'll say, okay, so I have these digestive issues. Oh, and then on a completely separate note, I'm also struggling with my hormones. Oh, and also, I just thought I'd mention, probably completely unrelated, but I have major skin issues and, really bad eczema. And actually, I'm like, it's not unrelated, it's all related. It's one body, it's one system, right?
Everything's connected. And I think especially between medicine and dentistry as well, it's almost like what happens here is us. And this is linked to everything else. But yet there's a massive disconnect between medicine and dentistry. And I don't know why.
There really is. So tell me, let's start with what negatively affects our oral microbiome, or what mistakes are we making? I know you touched on diet briefly, but what are we eating, drinking, doing that's harming our oral microbiome?
Yeah, so anything we're eating which is sugar, we used to always just say, oh, it's sugar. It's not. It's refined carbs become sugar in the mouth quickly. It's creating that acidic environment where we can negatively affect it. It's not flossing. Most of the population doesn't floss. And I always say to my patients, I say, do you floss? And they're like, yeah. It's like, do you really floss, and every so often, like once a month. Most of the population doesn't floss, so a lot of the bacteria gets built up in between the teeth. It's seeing the hygienist regularly as well, because we all get tartar, we all get calculus. It's making sure that's cleaned up more, because the more bacteria we have in the mouth, the more this commensal and this disease-causing bacteria is coming out of balance. So it's seeing the dentist regularly so we can check, seeing the hygienist really regularly so they can make sure it's clean. Good oral hygiene, tongue scraping as well. That's a really big thing, and most of the population doesn't tongue scrape either.
I've heard about that. I that keeps popping up on my Instagram, and everyone's talking about tongue scraping. What is it, and what does it involve, and what are the benefits?
It's so important because we can get this plaque on our tongue. So we talked about the nitric oxide. So when you're breathing into your nose,
Yes.
nitric oxide, that's it. Yeah, it's delivered into the air, and then it reduces your blood pressure. It's a wonder molecule. We think it could be involved in cognition, in all sorts of things. It's antibacterial, but it certainly reduces the blood pressure. So we've got that in the mouth as well. We have commensal bacteria, and then they make these nitric oxide from green leafy vegetables, nitrates, anything nitrate type in your diet. If you've got enough of that, it creates nitric oxide, and that gives that exact same reducing of blood pressure. There was a study done recently, and we were looking at mouth rinses thinking, why are certain types of mouth rinses causing an increase in blood pressure? And we couldn't really work out why. But then we started to realize it's killing the commensal bacteria. So it's killing this bacteria that creates the nitric oxide. But it's also the same with the tongue. When you have these plaques over the tongue, that blocks it. If you can think about the bacteria, there's always a battlefield in the mouth, and there is elsewhere in the body. Once you've got these thick plaques of the wrong type of bacteria, then it stops the right type of bacteria working. So we need to clean these plaques off so these commensal bacteria can work effectively. And I always say to the patient, start off with it, see how you feel, do it until it goes clear. Make sure every time you're cleaning your tongue, the colour will gradually go clearer and clearer. See how you feel in 3 weeks, and I can guarantee it. Once I've got patients to that level, they will not go without tongue scraping. They won't leave the house. It'd be like brushing and hopefully flossing. So they will not leave because the mouth feels so much cleaner.
So interesting. And you mentioned mouth rinses. I actually wanted to ask you about mouthwashes. So I think a lot of people think that they're this kind of, cure-all for good breath or getting rid of bacteria or feeling minty fresh. But should we be using mouthwashes? Should we be avoiding them altogether, or are some better than others?
Been very careful. So I'm one of the few dentists, and I don't know whether other dentists would sort of get me for this, but as far as I'm concerned, we know there's this very delicate balance in the mouth. We know it's delicate. We know the mouth is very exposed, and we know it's a delicate balance. We've got to be careful. It's more delicate than we once thought, the oral microbiome. If we're using some of these really strong mouth rinses, they're powerful, they're really powerful. Yes, they're going to kill some of the disease-causing bacteria, but they're going to kill some of the commensal bacteria too. So we've got to be careful. Anything which says kills 99% of bacteria on the bottle, that's a definite no. I'm not a general mouth rinse fan. I'm much more of a fan of tongue scraping, flossing, brushing, and making sure we can keep the mouth clean that way. I think Invivo, which is a company that does oral microbiome testing, I think they've just released a mouth rinse. I would imagine that's probably quite a good one because it's from a company that tests oral microbiome. That's one of their things. But I think anything we use, I think including some of the toothpaste, I think we've got to be very careful of anything which is too antimicrobial.
Yeah, definitely. I agree. Invivo is a nice brand. I like to recommend their products for the gut microbiome as well. So I'm
Yeah.
sure they're great for the oral microbiome. So they do testing, you said. Should we be testing our oral microbiome? Is that something that you recommend?
I do. The testing's improving more and more and more. When I started to do testing years ago, it was just giving types of bacteria. So we talked about P. gingivalis. You could have P. gingivalis in your mouth, and most people do, and I'll have P. gingivalis, but the P. gingivalis I could have would cause me a lot more troubles than the one you would have. It's to do with these strains of bacteria. So the earlier testing, it was worthwhile and it is good, but it's getting better and better. So the later testing, we can look at the strains of bacteria as well. So we're not just looking at P. gingivalis, and this is the one we're worried about with all different types of Alzheimer's and all different types of these conditions all over the mouth, but it'll give us strains. It'll also show us how your body is reacting to it. And we are actually getting to the point where we can do some genetic testing as well. So we can test which patients have got more of a genetic risk. than others. So if we put all this together, we can look at the types of bacteria, the strains of bacteria, how the patient's reacting to the bacteria. And then from that, we can look at genetic risks as well. We can give this to the patients. And we know we need to improve on the accuracies. They are needing to be improved, even though they can seem all singing and dancing at the moment. We still need a little bit more. We need more research, and we need these tests to get better and better and better. I still do it with patients, and I'm very honest with patients saying they are accurate. It's a bit like my Aura ring. I like using it, but I know it's not as accurate as it can be.
I love my Aura ring.
They're brilliant, aren't they? But I can wake up twice during the night and I think, well, it's not registered that. So they're brilliant, and it helps you look at how your life can be, and it's really affected how I sleep. But it's the same with the microbiome test. I say to the patients, we do need to go a little bit further with accuracy, but it'll give me a ballpark figure. It'll give me an idea. And from what we've done, we can see you've got periodontal disease. We've got this type of bacteria, this type of strain.
Our phone rang. Will you just just rewind like 10 seconds so that we don't get that sound in? Okay.
So it's the same with genetic, but it's the same with the oral microbiome testing. I'm very honest with patients, and I just say to patients, look, they are getting it more accurate, but we've got a way to go. But it gives me this ballpark. If you've got periodontal disease, and we know you've got this type of bacteria, that type of strain, your body's reacting this way, and we know you've got this genetic risk, we can then sort of tailor the treatment accordingly. And it's a great motivator. If I say to a patient, look, you need periodontal therapy, well, I don't really want to go, time's difficult. Okay, well, look at this. This is your clinical picture. This is some of your data. This is what we can see from your test. These are your risks. It's amazing how people, when they can see there's a risk and they can see there's these types of bacteria and these types of strain, how they think, okay, I really do need to go and get that periodontal therapy. It makes people floss more. It makes people look after the mouth more. It makes people look after what they're eating more. They're going to look at nutrition differently. And as it gets better and better, we'll be able to tailor it to them much more laser guided. So we'll be able to say, well, with this type of meal, we've got to be careful with this in the diet. We could add this in the diet. We can be more laser guided with probiotics and prebiotics. At the moment, it's still quite general, but it would be much nicer to be able to laser pinpoint and just say, this is your makeup. This is what we need to do.
So interesting. And let's say someone tests and they find out that they don't have the best oral microbiome. Is it something they can change? Is it easy to change? Does it take a long time? And what kinds of things would you advise? Obviously, flossing, brushing.
I mean, that's often a lot of it. It's changing the way they diet. So if there is that risk for decay, it's like, well, every time I see you, there's another hole. Now we've got this test which shows this. This is what you need to be careful of. We need to really be careful with, and not just sugars, refined carbs. We can then tailor how they're living their life with what the food they're eating, the way they're brushing their teeth. We can also look at probiotics. And I think there's one case when an American colleague of mine, a patient was having different blisters in the mouth, and it had gone on for ages and ages, all sorts of different advice. Nothing was working. And then they managed to, with a doctor, do all sorts of different types of prebiotics, probiotics, and just gradually change that concentration. So it's still got a way to go, but yeah, it's certainly a motivator to eat better, sleep better, and give up smoking, because smoking, sleep, stress, they all negatively affect the oral microbiome too. So it's a motivator to be able to, a bit like the Oura ring is, it's that motivator to be able to try and live better. And
yes.
Same sort of thing with Zoe.
Absolutely. I think all of these kind of wearable tech gadgets, they may not treat the issue or manage the issue, but they can motivate and inspire you to get into bed an hour earlier, or, wind down, stay off your screens late at night if you're tracking your sleep, for example. I know that makes such a difference for me.
I honestly think it's those small changes, because I spend a lot of time with my patients and sit down and just say, look, I know it sounds a lot, but flossing is a small change, but it could massively make a difference. If you think we can keep your mouth cleaner, you're less likely, remember, you can't have a healthy body and have an unhealthy mouth. It just can't exist. If you've got an unhealthy mouth, if you've got really bad periodontal disease, it is absolutely going to affect your body at some point in some degree. And I'm really quite strong with my patients saying this is going to affect you. And if we're not going to get this sorted, I promise it's going to affect you medically. It's not just about losing teeth anymore. It's not just about you having to wear a denture, or it's actually about your general health as well. And I think this is where we're getting to, and this is where hopefully oral microbiome, the more we learn about it, the more we can sort of say to patients, you've got terrible diabetes. We know there's a link. You've got to get rid of this periodontal disease. You've got to take better care of your mouth. And it's amazing how we can then start. It'd be wonderful if we can get to the point where we can help the medics treat systemic illnesses by making sure patients keep their mouths healthy.
Absolutely. So, what can we be doing from a dietary point of view, apart from avoiding sugar and refined carbohydrates? Are there particular foods that we should be eating for our mouth, our oral microbiome, our teeth? Obviously, you hear about the importance of calcium for teeth. Any other
Yeah.
nutrients we should be
Yeah,
thinking?
yeah. I mean, a lot of people talk with calcium and say, oh, it's all about the calcium, but it's not. It's the vitamin D, it's the vitamin Ks, it's the phosphorus, it's the magnesiums. It's all about not just getting the calcium, it's getting the calcium into the right place. So calcium absorption is not just to do with calcium coming into the body, it's how it's absorbed. And there's a lot of other nutrients involved in the absorption and the transport to where it needs to be. So it's having that balance of diet. And then there's also like the nitrates from the green leafy vegetables for the nitric oxide as well. But it's having that full balance and knowing it's not just calcium. You can't just take a load of calcium supplements. There's vitamin D2. There's all different types of nutrients we need as well. The K2s, the D3s, we need them all in a lot of balance as well. But I would much prefer to be able to laser guide from testing, saying, well, this is your test result, this is why we need to, but we're still a way off that.
So interesting. I think it's amazing how the food that we put in our body can have such an impact on all these different systems, from our teeth and our oral microbiome to our gut and our skin and our hormones and weight, obviously, and so many other factors. So that's super
Actually, the food, the environment we create is from the food and what we do and how we live. And I think it's getting the patients to take that ownership as well.
Definitely. That's so important. Now, on the Gut 360 podcast, we always take a 360-degree approach to health, obviously, nutrition being one piece of the puzzle. But I was wondering, what impact can stress and lifestyle have on our mouth and our oral microbiome? How's that related?
Stress completely to do with grinding. So we're seeing quite a lot of tooth grinding because of stress, but it can also be other things. So we talk about sleep. So if we've got problems with sleep apnea, snoring, bruxism and grinding can come from that and then damage. And so there's a relationship between stress, sleep and the teeth. I see a lot. I used to have a clinic in Manchester, but I work in London now and I see a lot more grinding. So it can be sleep related from the grinding, but it can also be stress. So it's holding your teeth together. It's that control from when life can feel a little bit out of control. It's that stress and that anxiety can manifest in grinding teeth. That can fracture teeth and give headaches. And it stops the sleep as well. We both know when you're going towards the deep sleep and the REM sleep, if you're grinding your teeth, you're going to go up towards it and then back down again. You're never going to be you might spend 9 hours in bed and you might spend 9 hours asleep, but if you're grinding all night, you're not going to get to that point where you're getting the really effective sleep.
So important to understand that. And you know what? I'm not surprised that you see a lot more grinding in London. Everyone in London is super stressed all the time, aren't they?
Yes, everything's fitting into time and everything's time. And I'm seeing a lot more of it than I did in my Manchester clinic, a lot more tension. But we need to make sure we don't treat grinding from a stress and miss out the fact there's a sleeping issue underneath, because sleep apnea and snoring can then cause the grinding.
So important to look at it like that as well. So what does the future of the oral microbiome look like within dentistry? What's next?
A lot of research. A lot of these things that you might have seen in the newspaper, the Alzheimer's, the heart disease, the cancers, we are there with some of it. Like with the diabetes, we've got a little bit more evidence, but there's correlation and causation. So we're correlating a lot at the moment. The bacteria in the mouth and our oral microbiome, we are correlating with a lot of problems in the body. More research needs to be done to make sure it's proper causation. We need to know definitely what it's causing, what mechanism it's causing, how it's causing it, so then we can affect and treat it as well. So that's the first thing. The oral microbiome testing becoming more accurate and being able to put it into dental practices would be amazing. So we can every patient comes in, they have a test, an oral microbiome test, when they're as accurate as they need to be. We can say, and we are getting really close, we can say, look, this is the makeup, this is your periodontal disease what you've got, this is the decay you keep getting, this is your risk factors, this is how your body is reacting to it, and tailor everything according to that. And it would be lovely to be able to get to the point where, a bit maybe like with the Zoe, where you've got an app on your phone where you can say, okay, this is my oral microbiome testing. This is the type of food I should be eating because of what's the last test. This is the food I shouldn't be eating. And really make it almost like a wearable, so people are getting constant data to be able to motivate them to be able to get treatment, to look after them out as healthy as possible. And I think the more we learn about the oral microbiome, the better we can treat systemic problems, because I've no doubt by treating the periodontal disease, the gingivitis, we can help all these problems in the body with the diabetes, the rheumatoid arthritis, reducing risks of different cancers. Although we're not quite there with the research, I've no doubt it's likely to go that way, because there is evidence pointing to all these things. And it's great when it is getting more news coverage at the moment. It is in the newspapers, it is on podcasts, it is going on TV documentaries, which is brilliant. And I think the more the awareness, if we can get more awareness on the oral microbiome, the better. And I think it, thankfully, for things like Instagram and things like these podcasts, it does get people thinking. It does bring the knowledge of the oral microbiome more to the forefront. And it's, if we can follow the way that it's gone with the gut bacteria, most people hadn't really heard much about the gut bacteria 15, 20 years ago, where virtually most people you talk to now go, oh, well, you know, it's to do with my gut bacteria and my gut health, and how important gut health is for the whole body, the way it functions. We need to link that in with the mouth. And we also need dentistry and medicine to link as well and as thoroughly as we can as well. That would be a wonderful future.
Yes, 100%. I'm so excited for all the research that is still to come. I know it's in its early stages now, and there's a lot more to look forward to. So I have one more question for you, but before I ask the final question, I'd love to know, how can people find out more and get in touch with you?
So I've got my Instagram, the Bespoke Dentist London, the Bespoke Dentist. We've got a website. So if you want to, you can book in with us. We have a WhatsApp, so they can contact through the WhatsApp. I generally try and answer questions through Instagram as well. The amount of direct messages I get on a daily basis, I can't get through them all, but I try and get through most of them myself. If I'm honest, I only work 3 days a week and have 2 days off to give back. So it might be lecturing, it might be doing oral health education in schools, it might be different things. But what I try and do on my 2 days off is answer questions that people have. So I'm more than happy to answer questions.
Amazing. Well, I'll leave all your details down below in the show notes. Now, Daniel, we have a closing tradition on this podcast where I ask every guest, what does a 360-degree approach to health look like for you personally?
Do you know what? Like we were saying, the wearables, I think that's really, because it's the data, it's that constant data, it's that looking at your ring, thinking, right, I need to go to bed, looking at the Zoe app or taking something, going, oh, I have that every lunch, well, that's not very healthy for me, I'm going to have to swap. It's the technology, it's involving the technology, so then we can get a 360 look, looking at the sleep, the diet. I think the wearables and data, and patients having data on the phones, whether it be apps, that's the 360 for me, because it helps people look after themselves, to keep people in the best possible health.
I love data as well. It's interesting that my guests have mentioned that in their answers, but it's, yeah, the more data I can collect and track, I just find it fascinating. Obviously, I'm cautious to live my life dictated by data. Sometimes I'll wake up and I'll look at my Oura ring and it will tell me I've had a terrible night's sleep before I've even got out of bed. And then I just feel like my day's ruined.
Psychologically, it affects you then.
Yes, it really does. It really does. But it's been such a pleasure having you on today. Thank you so much for all the interesting knowledge and wisdom that you've shared with us today. And thanks for coming on to the Gut 360 podcast.
I've thoroughly enjoyed it. Thank you very much.